Welcome to Dateline Health. This is Fred Lippman coming to you from Southeastern University. And as I always tell you, week after week, this is your show. So today we have requests from many of our viewers. We wanted to talk about something called DVT, some vascular diseases. So best way to talk about it is talk to people who know what it's all about. To my immediate view is an old star of ours. He's been here in a number of different ways. He's a OBGYN gynecologist. He's the director of our Women's Center. I always want to say Health Center. And it's Dr. Ken Johnson. Welcome, Ken.
It's great to be here.
Good to see you, sir. And to my left is another individual who I have just found out is another graduate of ours, and that's Dr. Susan Fox. And she is specializes in vascular medicine, correct? Mm-hmm. And you're from Memorial Regional Hospital, and they asked, when we asked them for expertise, they said, Dr. Fox. So here you are.
Thank you.
And you're located at in mostly Memorial Regional, Memorial West, right?
Yes.
That's where your offices are. You know, both of you, I guess, have different views of what the questions were, but I'm going to start with you, Dr. Fox, if you don't mind. The primal question that came to us, and we're going to expand on it, was a lot of people talk about DVT, and I want you to explain what DVT is.
DVT is actually we usually refer to as venous thromboembolic disease. Mm-hmm. Venous thromboembolic disease is a compilation of DVT, which is deep vein thrombosis, and pulmonary embolisms. It's when you have a clot in the blood in a vein. Normally it locates in the lower extremities. If that travels through the right side of your heart to the lungs, then it's considered a pulmonary embolism. There's a very high incidence of it in the United States. It affects about 1 million to 2 million people in the United States each year. About 250,000 people are admitted to the hospital each year with venous thromboembolic disease, and there's about 200,000 deaths each year. It's the fourth leading cause of death in the United States and the third most common cardiovascular cause of death after heart attacks and strokes. Mm-hmm. If you look at the number of people that it affects, more people die each year of venous thromboembolic disease than AIDS or breast cancer or many of the other health concerns that people have.
So I guess the viewers, and again, a lot of our viewers are very... They seem to not only view other television products and programs and listen to, a lot of folks listen to public television, and they listen to these health reports. And I guess that's where a lot of it has come from, because they respond by writing to us and say, hey, Dateline Health, Dr. Lippman, can you talk about DVT? Well, you know, then most of it is associated with, and a lot of their comments come from, well, you know, that I've been warned if I'm going to be traveling for a long distance in an airplane, or if I'm driving in a car and I want to drive through, et cetera, et cetera. Explain to me what the characteristics of their comments really are relative to this. So they must have been warned, I would assume, or cautioned, as to the fact that be careful. So talk about it.
I think that this became a little bit more common once we saw David Bloom pass away several years ago, the NBC news correspondent.
Right.
And I think people became a little bit more aware of the fact that long travel can cause blood clots and possibly death from them, from a massive pulmonary embolism. When somebody travels and they travel, usually the cutoff is about 6 hours. A long-haul flight is considered a greater than 6-hour flight. Your risk of getting a blood clot goes up to about 1 in 700,000 passengers over 6-hour flights. Below that, you still have a very high risk, and somewhere between 4 and 6 hours is kind of a gray area of increased risk. Anybody who's traveling for long distances, especially if they know they've had any recent risk factors for getting a blood clot, such as immobility, they were casted recently from a fracture, any trauma, if they're very sedentary or immobilized for any reason, they had recent surgery or hospitalizations. Those people are at a higher risk for getting a blood clot, or if they know that they have a clotting disorder or somebody in their family had a clotting disorder, they should probably get up, walk around frequently, especially if they're not able to move their legs very well and they're in cramped conditions. They should pump their calves or mimic kind of like stepping on the gas pedal so that they activate the calf muscle pump to help propel blood up the legs. And they should drink a lot of fluid and move around frequently.
Dr. Johnson, many of the comments came from our female population that view the show. And a lot of those comments were attendant to the fact that, moms, they're traveling, they're holding a child on their lap or otherwise. They can't get up and walk around. Dad or my traveling companion is walking around or whatever. And they have experienced some of these issues. And a lot of them, and I don't know, I'm going to ask you to comment on it, a lot of them talk about after childbirth that there seems to be more cramping, and they talk about varicosities and things of that nature, which we're going to talk to you, Dr. Fox, about shortly. So just let's talk about, again, let's amplify on what Dr. Fox was talking about, but particularly, we had a lot of comments from our female population.
Well, as you know, the pregnant patient is predisposed to DVTs. And I'm very excited that at North Broward Hospital District we've now implemented a policy where we're putting the compression stockings that Dr. Fox mentioned that actually artificially cause contraction of the calves for our pregnant patients. Pregnant women have an increased risk of clots due to the combination of three things in Virchow's triad. Hypercoagulable state, they're more prone to have clots in pregnancy. Immobility that Dr. Fox mentioned, pregnant women are laying down a lot, especially when they're in labor in the hospital. And finally, endothelial damage. We do a lot of cesareans these days, and that injures the patient's endothelium, which puts her at risk for clots. So we're now using compression stockings in pregnant women just like we did in non-pregnant patients, and it's making a big difference.
Just two clarifications for the viewers. Endothelium is?
The lining of the blood vessels.
Right.
If that's injured, and it can be injured from immobility, trauma, cancer, a patient is at a higher risk for DVT.
And also you use the word hypercoagulation or hypercoagulable. Explain that.
Just the components during pregnancy that relate to the way the body forms clots are at increased risk. They're at different levels. Different levels of clotting factors make pregnant women 10 times more likely to have a clot as non-pregnant patients.
Do I assume that that is due to the fact that the body is preparing for delivery of the child, and therefore they do not want the host, the woman, to bleed extensively? Is that it?
That's
so
exactly
the body
it.
produces its own coagulation system, and that also can cause this problem of creating clots. Is that what you're talking about?
Absolutely. It is a physiological safety mechanism for women who are going to be prone to bleeding, pregnant women, but it has a downside. It increases their risk for clots.
Let me just stay on what Dr. Fox was talking about, because I did ask the question about travel. And it is a very, I'm just sitting here thinking, as the viewers have asked these questions, mom's in a plane, all right? They're flying to California, Las Vegas, or whatever. They're holding a child, it doesn't necessarily have to be a less than 12-month-old child. Sometimes it's, up to 2 years old or whatever. They may not be sitting in the seat. They may be sitting on their laps. They don't get up. They don't walk around. They don't do these things. Do I assume that you obviously ascribe to the same
Absolutely.
Commentary that Dr. Fox said.
Absolutely. Exactly what Dr. Fox mentioned is our recommendation universally for travel, but especially so for women who are carrying a child or are pregnant, and that is frequent movements. I tell my patients every 30 minutes, I want you to try to either stand in your chair, get out of your chair and ambulate if you can, but certainly contracting and relaxing the leg muscles is key. You want to increase that blood flow to the heart, as Dr. Fox mentioned.
Dr. Fox, let's get back to this again. The physiologic issues of you. So what happens is because of non-movement, because the body has certain coagulation systems, it creates these clots. All right, and of course we create this. You get either pulmonary embolus, or sometimes it goes beyond. You know, it carries beyond that. And so the danger is, and help me understand, is I would assume, I've been told that, you know, there are a lot of studies relative to stroke and cardiac arrest and things of that nature that come about. So let's talk about it.
Well, with the pulmonary embolism,
Right.
it usually lodges in the lungs, and
Right.
then it can cause sudden death. If you look at the data, about 30% of people die within 30 days of a blood clot. So you do have to worry about making sure that they're anticoagulated fully within the first 24 hours is very key. And putting on compression devices at Memorial Regional Hospital also, we have very strict regulations with anticoagulation, with compression devices as well. So we try to make sure that everybody is as safe as possible in those situations.
Our viewers asked the follow-up, you know, combined questions about, well, you know, certainly you see all these, unfortunately, this is just my semi-editorial comment, you see these ads on television for a lot of these things, and I'm not going to mention by brand name some of the anticoagulant drugs. In other words, do I have to be on that when I travel, or should I be on a daily aspirin regimen, something of that nature? What's your general comment? I mean, they're asking the questions.
According to the American guidelines, the chest physicians come out with guidelines every few years, and according to their guidelines, aspirin is not a preventive measure for venous thrombosis. Mm-hmm. So I have people every day coming to my office who are asking me if they should be on an aspirin a day. It will help your risk of a heart attack or stroke. However, it really has not been shown to decrease your risk of a venous thrombosis. So that's not a preventive measure. The main preventive measures are, as he also said, moving your calves, walking around, those kind of things. Should people be on blood thinners? They should be if they were prescribed it by their physician for either a genetic cause of a very high risk of having a blood clot, or having had recurrent blood clots, or they're in the treatment period for a blood clot presently.
To that issue, I know that, and we sort of, I guess we sort of preach every time we have the physicians on the show about these folks out here communicating with their medical professional without you communicating the indications of I have an ache or a pain or something unusual happens. You all as licensed professionals don't have the opportunity. You basically, if the patient doesn't communicate, it's very dangerous. So folks, remember, we got to be communicative to all of our doctors. The questions, though, that we hear following up on that is, and again, it's a lot of it was driven by what I would call retirees and really dominantly female questions that came to us. Not that this is a gender selective issue, but that's where it came from. But I guess it's the sedentary issue. It's the fact that people don't move around. They get into a car, just going through, I mean, just looking in this area, driving out of the state of Florida, you're driving 6 to 8 hours just driving out of the state, maybe 9 hours out of the state of Florida. Or you might have a rest stop break or something like that. I assume that's what you're telling them. Very simple, common sense prescriptions for these folks to prevent some of these features.
That, as well as making sure that if you are hospitalized or if you do have a surgery, that you discuss with your physician if you do have a hypercoagulable state, as he said, or you're known to have risk factors for a blood clot. Risk factors can be obesity with a BMI greater than 30.
That's body mass index?
Body mass index.
Okay, go ahead.
People who are considered very obese. People who have congestive heart failure. People who have COPD or chronic obstructive pulmonary disease. People who have had strokes or immobility due to paresis. They've had spinal cord injuries.
Tell me what paresis is.
Not the inability to move a limb or a side of the body, either due to strokes or spinal disease. All of these people need increased preventive measures, especially if they're in the hospital. When you look at data from different hospitals, if you look at just medical patients versus surgical patients and orthopedic patients, about 30 to 40% of medical patients who are on no preventive therapies can get blood clots. 60% of orthopedic patients who are having arthroscopic knee surgeries or hip surgeries can get blood clots, and about 80% of people who have spinal surgeries can wind up getting a blood clot. So it's very important for physicians to be aware of this, and at Memorial Hospitals we have regulations in place, as do many other hospitals, to make sure that everybody is on preventive measures, either with sub-Q Lovenox or heparin, blood thinners that you would get either by injection or by IV medications, to make sure that their risk does go down. About 10% of people, they think even up to 30% of people who pass away in the hospital die because of pulmonary embolisms. So 5 to 10% of deaths on autopsy are definitely known to be at the outset pulmonary embolisms, and up to 30% after autopsy are found to have pulmonary embolism as their cause in hospital deaths. So this is very important for people to be aware of, and most hospitals, especially, we're very aware of this at the Cardiovascular Institute at Memorial Regional Hospital, that people do need to be on preventive measures.
Well, I'm glad you brought that to the attention, because it really is, I mean, one of the strengths, I think, of our community of viewership is that we have some very, very efficient systems in place, not only in our public hospital districts, the North and South Broward Hospital districts dominated by Memorial Regional Broward Health, and all the other hospitals in there. I don't want to leave them out. All you guys at Imperial Point and Memorial West and wherever, I don't want to leave you all out. But everybody really has to know, as well as our, our other partner hospitals, the compatibles, the Cleveland Clinics and the HCA hospitals and the Tenet hospitals, all have protocols that are in place, because it's rather dramatic, folks, and I hope you listen very carefully to Dr. Fox. It is rather dramatic to know that, of the number of unfortunate fatalities that come about due to this pulmonary embolus, which is really the function or the situation that's occurred by DVT and other issues, correct?
Yes.
Dr. Ken Johnson here, we're letting you sit here, but Dr. Fox was doing such a great job.
She was. I mean,
it was really fascinating to listen to the statistical information. I hope you folks really listen carefully. We've also had these commentaries, and I know that this is a subject area that comes up, and it's, sometimes people talk about it, sometimes they don't talk about it, but it always comes up and is always back there. People talk about oral contraceptives and hormone therapies and the consequence of clots. You want to talk about it?
Well, certainly.
Potential.
Certainly, there is a very important concept in combination birth control pills. We prescribe millions and millions of women contraceptive birth control pills, but we less and less are offering them to women who smoke, women who are obese, as Dr. Fox mentioned, and women who have some of these genetic predispositions for clotting. combination birth control pills can increase the incidence of blood clots in women who are at risk. And that would be women who are obese, women who smoke, women who've had a previous clot, or women who are known to have certain genetic defects like factor V Leiden. We actually screen our patients. If their families have a high risk of clots, we screen our patients for these genetic defects that predispose women to clots. Outside of risk factors, combination birth control pills are extremely safe.
And the other thing, because you just hit on it, I know that I knew of the genetic screening. I didn't know specifically of the name, but which I'm glad, and we'll put it up so that people can take a look at it. But are there familiar indications? You know, something has happened. Oh, my grandma. Something happened to my aunt. Somebody help me.
Absolutely, Dr. Fox.
There absolutely are inherited genetic factors that cause people to be more predisposed to blood clotting disorders. There's the most common one, which, as he touched on, factor V Leiden. There's also prothrombin gene mutation, 20210A is another one. Then there's more rare things like antithrombin deficiencies, protein C deficiencies, protein S deficiencies. Cancer is a huge hypercoagulable state, and anybody with cancer definitely needs to be careful that they don't develop a blood clot. So we always look for heritable states. When somebody's young and they have a blood clot, usually the cutoff is in the 40s. If you have a blood clot and you're in your 20s or 30s, that's when we start looking to see if there's a heritable factor, as well as if you come in and say that you have about 2 or 3 family members, or you've had recurrent miscarriages is another tip-off that you might have something else going on.
That was going to be my next question, Dr. Johnson. That's why I'm pleased that you're here, because we hear a lot about the so-called miscarriage, question, and here we have it. There it is. So let's talk about it.
We've been successful in defining the risk for miscarriage as it relates to DVTs. It's actually called antiphospholipid antibody syndrome.
Well, that's a lot of stuff, folks. Go ahead.
And so we now know that women who miscarry due to clots actually are carrying certain components in their blood. Lupus anticoagulant and cardiolipin antibodies predispose women to miscarry by way of the clotting risk. And so we're now screening women who have early miscarriages for these risk factors for clotting.
Okay. Well, I think it's important. There's a lot of technical language being thrown your way, my dear viewers, but I really think it's very important for you to hear it all. We're down to the last 3 minutes of the show, and I have so much more that I want to know, but we're going to do it in 3 minutes. Just one thing, Dr. Fox, I've seen it. I'm a viewer of readable things. I still read newspapers, and I always see discussions from your practice about varicosities, about doing work on varicose veins. Is there any connection, or just talk about it very quickly?
We do a lot of venous interventions at our group with cardiovascular consultants of South Florida. About 2 to 5% of all Americans are affected by chronic venous insufficiency. Some of it is due to post-thrombotic syndrome. About 30% of people within 10 years of getting a deep vein thrombosis or a blood clot in their leg can develop post-thrombotic syndrome. And that leads to these chronic symptoms of swelling, varicose veins, chronic leg pain. And there are brand new interventions that have come about that have taken place in the past 10 years, where we're able to do minimally invasive procedures in the office using lasers or radio frequency devices to close down the veins and get people back to their normal lives within hours.
Yeah, I've heard about it, and the reason I asked you before the show was living out in the Pembroke Pines region, I've heard a number of people talk about visiting your, not necessarily Dr. Fox's practice, but your multi-member practice, and having work done on their varicosities or varicose veins, both men and women. So I just thought I'd bring it up. Dr. Johnson, we're down again to the last few minutes of the show, but I know that how forceful you are with your commitment to wellness, and not only for the OB and gynecologic patients, but the general female population, because it's one of the missions of the Women's Center. Let's talk very quickly, because we need to give you 1 minute to talk about it, the wellness issues. Issues about not taking alcohol and smoking and things of that nature.
Certainly, modifiable risk factors is our passion.
Right.
And with respect to DVTs, I think Dr. Fox mentioned a very important component, obesity. We're very proactive about helping our patients find a healthy lifestyle, including getting back to their ideal body weight, decreasing their smoking. And it turns out that diabetes is a very high risk factor for blood clots. So by lowering obesity, by having our patients exercise, I think we'll all do better in reducing this very dangerous risk of DVTs.
Well, we're just down to the last minute and a half of this show, so it's my time to talk to our viewers and to tell them one more time, you've got to communicate with your medical professional. They can't be miracle workers. They're trying to help you deal with your problems. And I believe, and I'm sure that your practice believes, Dr. Fox, and of course I know that at the Women's Center here at Southeastern University, that we believe, we advise, we near preach wellness and commitment to taking care of yourselves. You can have all these wonderful tests out there and otherwise, but unless you communicate with your health professional, you're never going to be screened. So you must communicate. Don't put things aside. And with all the abilities that we have, particularly through our advanced senior population and all their Medicare coverage and other things, so many things are involved and available to them that you need to take advantage of the wonderful health professionals that are in front of us here. So Dr. Susan Fox, thank you very much for being here.
Thank you.
And I know again that you're at Memorial Regional and Memorial West, and you are representing the Memorial Health Systems, and I thank you very much. Mr. Sacco is a wonderful leader. And of course, Dr. Ken Johnson, you're the director of the Women's Center here at Nova Southeastern, right on University Drive in 30th, correct?
That's correct.
Third floor, if I'm not mistaken.
Third floor, come see us.
You got it. And of course, you are very actively involved at Broward Health and particularly Broward General. And we know that Mr. Nask, who is a colleague of Mr. Sacco, is also doing a great job. So we thank all the folks that are out there. I know you were trained at Cleveland Clinic, weren't you?
Yes, I was.
Right.
In Cleveland.
At Cleveland.
In Cleveland.
Right.
Wow.
Whatever. So here
Nice.
here we have this compendium of knowledge brought to you at your request, and I hope that we answered some of your questions. I hope we stimulate some active thinking about what our doctors have said. And remember, this is Dateline Health. It's your show, and if you need to call us, the number is right here, the email address is right here. Send us your questions. We'll try to get them on to the doctors, and we'll try to get you further answers. And as I said before, this is Dateline Health. This is Nova Southeastern University. This is where we're from. And until next time, this is Fred Lippman saying, see you.